Hello everyone, please contact Professor Robert for a sample or a customized paper of the following or any other assignment. NR509 iHuman Virtual Patient Encounter Abdominal. Description: preparing the assignment. Follow these guidelines when completing each component of the assignment. Contact your course faculty if you have questions. General instructions. Remember this: for this week's iHuman Virtual Encounter cases, you will only get one attempt. Attention! Multiple practice attempts allow students the opportunity to review feedback from iHuman, including documentation. Feedback is to be used to guide improvement on subsequent attempts for the practice case. It is never acceptable for students to submit feedback verbatim, or almost verbatim, and/or documentation in the air. Copying using the work of others is a violation of CU's academic integrity policy. Violations will be fully investigated by faculty and administration. Access iHuman by clicking the link on the following page. Click the blue bar to launch the activity in a new browser window. The case does not need to be completed in one sitting. It can be re-entered at the same point at a later time. All graded documentation, including the management plan, must be completed within the iHuman platform. Follow the iHuman documentation guide links to an external site. To complete your client's electronic health record, ER, and management plan, use current APA style standards to format citations and references in the management plan and reflection. Use https://apastyle.apa.org/links to an external site, and APA academic writer links to an external site. For formatting and grammar assistance, include the following sections, detailed criteria listed below, and in the grading rubric. Complete the following components in the iHuman Virtual Patient Encounter for the required case addressing the abdomen. 1. Focus Health History. 1. Complete a focused health history. Scores are automatically calculated within the iHuman platform when the health history is submitted. 2. Focus Physical Exam. 1. Complete a focused physical exam. Scores are automatically calculated within the iHuman platform when the health history is submitted. 3. AIR Documentation, Subjective Data. Document the history of present illness, HPI, and focused review of systems, RAS. Documentation must be 1. Accurate. 2. Detailed. 3. Written using professional terminology. 4. Pertinent to the chief complaint. 5. Include subjective findings only. 4. AIR Documentation, Objective Data. Document physical exam findings. Documentation must be 1. Accurate. 2. Detailed. 3. Written using professional terminology. 4. Pertinent to the chief complaint. 5. Include objective findings only. 5. Key findings: most significant active problem. Document key findings from the history and physical exam in the assessment tab of the case. 1. Identified the most significant active problem, MSAP, and the relation of other key findings to the MSAP. 6. Problem statement. Document a brief, accurate problem statement using professional language. Include the following components. 1. Name or initials, age. 2. Chief complaint. 3. Positive and negative subjective findings. 4. Positive and negative objective findings. 7. Management plan. Use the expert diagnosis provided to create a pertinent, comprehensive, evidence-based management plan. If a specific component of the management plan is not warranted, i.e., no referrals are appropriate for the virtual patient, document that no intervention is warranted. Include the following components. 1. Diagnostic tests. 2. Medications. Type a specific prescription for each medication, including over-the-counter medications. 3. Suggested consults, referrals. 4. Client education. 5. Follow-up, including time interval and specific symptomatology to prompt a sooner return. 6. Cite at least one relevant scholarly source, and provide rationale for interventions as defined by program expectations. 7. Click Submit once the case is complete. Use this guide to download the performance overview report links to an external site. 8. Reflection. Download this worksheet links to an external site. Address the following question. Some clinicians may find it difficult to explain the logic behind their clinical thinking. As you gain experience, your clinical reasoning will begin at the outset of the patient encounter, not at the end. Reflect on the clinical reasoning you used during this virtual patient encounter. Describe the steps taken to identify and interpret the key findings in this case. What are some lessons learned within the assessment that you can apply to your professional practice as a provider? Include the following components. 1. Type 150 to 300 words in a Microsoft Word document. 2. Demonstrate clinical judgment appropriate to the virtual patient scenario. 3. Cite at least one relevant scholarly source as defined by program expectations. 4. Communicate with minimal errors in English grammar, spelling, syntax, and punctuation. Submission. Submit both the performance overview report and reflection document to the Week 5 Dropbox. Thanks for watching.